What is a diabetic foot? Type 2 diabetes is a disease with many symptoms. One of the most common symptoms that occurs, sooner or later, is a diabetic foot. What begins as a mild symptom can quickly escalate into serious foot problems. If you have type 2 diabetes, it's smart to know how to recognize a diabetic foot and when it's necessary to see a doctor. In this video, you will see 5 symptoms commonly associated with diabetic feet. I will also give you a checklist to prevent serious foot problems. Symptoms of diabetic feet. Number 1. Pain in the feet and legs. As mentioned, a diabetic foot starts with pain. This pain can occur for 2 reasons. First of all, you have to know that the smallest blood vessels in your body, your capillaries, get clogged up because of the excess sugar in your bloodstream, thus blocking important blood flow in the legs, feet, and toes, and preventing them from getting the blood and oxygen they need. At the same time, the body is unable to properly dispose of metabolic waste products. When blood flow to the muscles is reduced, vascular claudication can also occur. This is when the resulting lack of oxygen causes pain in the legs. In most cases, the pain will go away if you rest. But type 2 diabetes also damages the nerves in the feet, causing a burning sensation. The skin becomes very sensitive and can barely tolerate even the slightest touch. Number 2. Cold feet due to diabetic foot. When blood flow is blocked, the body is no longer able to keep all the parts nice and warm, and that's the precise cause of cold feet. Many diabetes patients have problems with the nerves in their legs and feet, especially elderly people who tend not to move around so much. Lack of movement results in reduced blood flow. And lack of movement in combination with type 2 diabetes dramatically reduces blood flow. This can change the way your feet feel things and can also cause the sensation of cold feet. Number 3. Red foot as a complication. As if painful, cold feet aren't enough, a diabetic foot can suddenly become red, hot, and swollen. You can also feel tingling sensations, as if ants are walking on your foot. This red foot symptom can have 2 major causes. 1. An infection, since type 2 diabetics are more susceptible to skin disorders. This is connected with the poor blood flow mentioned earlier, which prevents the body from fighting the infection. 2. Charcot foot, a deformation of the foot due to weak bones and characterized by a swollen red foot. The bones in a Charcot foot are often subject to multiple fractures sustained because of a lack of feeling. The places where the broken bones press on the foot are prone to developing large infected ulcers. Number 4. No feeling in the feet. Neuropathy is the medical term for nerve problems, and it can occur in your feet when you have type 2 diabetes for quite some time. It's entirely due to having constantly high blood sugar. The excess sugar in your blood damages everything in its way, including the nervous system. This causes neuropathy. When this happens, you will experience different complaints in your feet. 1. Reduced feelings in your feet or toes, even complete numbness. 2. No perception of temperature change. 3. You can't feel pressure applied to or by your feet. 4. You feel as if you're walking on cotton wool. 5. Extreme pain. Eventually, you may feel absolutely nothing at all, meaning you won't notice things like shoes that are too tight, water that's too hot to touch, or wounds on your feet, which makes it all the more dangerous. Number 5. Badly healing wounds with type 2 diabetes. It's very difficult to notice any wounds when you don't feel them. You either notice them by chance or make sure you do a regular checkup. There are 2 major problems when a wound occurs in a diabetic foot. First of all, because of neuropathy mentioned earlier, many diabetics simply don't notice the wounds. Very often, when the patient does notice a wound, it's in an advanced stage. Most of the time, it's already infection due to a lack of medical treatment. And secondly, because of the blocked blood supply in the foot, wounds heal very slowly. When the small capillaries in the feet are clogged with sugar, neither oxygen nor any other essential healing compounds can reach the wound, thus preventing it from healing properly. That's why it's vital that you check your feet regularly and often. Even better, get them checked by a medical pedicure or specialist. When a wound is left untreated, bad things can happen. For some diabetics, it means the only option left is to amputate the foot. The do-it-yourself foot checklist. The bottom line is, take great care of your body and feet. That way, you prevent many problems. To avoid complications, you must do this regularly. Check your feet daily for wounds, excess calluses, or other abnormalities. Use a mirror to check the bottom of your feet and between the toes. Don't walk barefoot. When you walk barefoot, you increase the risk of getting wounds from a piece of glass or by striking your toe or foot against a hard object. When cutting nails, cut them straight and not too short. While lengthy toenails can irritate and damage other toes, it's also very important not to try and cut them extra short and injure them by accident. Wear comfortably fitting shoes. Tight shoes can cause excessive pressure that will injure your foot. When you have no feeling in your foot, consult a podiatrist. He'll recommend which shoes will be better for your health.